What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos come in every week. You don't want to miss them. Today I have a very special guest who's going to tell us all about the field of foot and ankle surgery, why she went into it, and also some tips out there for students that may have some doubt about balancing family, being a wife, mother, and a surgeon as well. Dr. Aziz, welcome to the channel. How are you doing today?
I'm doing very well. Thank you so much for having me, Dr. Webb.
Absolutely. Absolutely. For the guests out there that may not know you, can you go ahead and introduce yourself and tell them who you are and kind of what you do?
Sure. My name is Dr Aziz. I am an orthopedic surgeon. I'm in my last week now of foot and ankle fellowship. I went to med school at University of Missouri, Kansas City. It's a 6-year BA/MD combined program. I then went to residency at Baylor College of Medicine for orthopedic surgery, and then I am doing currently fellowship at UT Health at McGovern School of Medicine in Houston, Texas.
Awesome, and congratulations. I understand what you're going through right now. These last few days, it seems like this year flew by for fellowship, but the last few days, last week, is going by so slow. I'm not sure if you feel the same.
Yep, absolutely.
Yeah.
It's been a pleasure to have this year to really focus and hone in on like the specialty that you want to do, but
yep.
Definitely slow. It just every day is just slower and slower and slower.
Yeah, exactly. Yeah, but congratulations on being so close to finishing. You mentioned the 6-year program that you did from is it a BA/MD? Can you talk about that? And some students may not know that's a potential option. Can you talk about that program and why you chose to take that route?
Absolutely. So this is a program that you get admitted to out of high school. So you interview for both undergraduate and medical school when you're in high school. So you better know that you want to do medicine. Mm-hmm. This program in particular did not require me to even take the MCAT. I had admission into med school right out the bat. But there are pros and cons, just like any program. The pros are obviously you have a guaranteed admission to medical school, which can be hard to get. It's a catered program to you, so it's 6 years, you save 2 years, which is great. The classes are catered to medical students, so like an undergraduate, you'll take biochemistry 1 and 2 in one semester, organic chemistry 1 and 2 in one semester, just to kind of get you through it and get you to medical school. Large cons are it's not cheap, it's pretty expensive, so you really have to invest in yourself and know that you can pay that back and be the doctor and repay what you took out in loans. Number 2, there's a high dropout rate because people have other interests, of course, and when you're that young you might not be making that long-term decision correctly. So there probably around 40% of my class, we start out with 100. I only matched with 60 people that we originally started out with. Some people extended to 7-year programs, some people to 8, some people decided they don't want to do medicine. Unfortunately, because it is so catered to medical students, those classes like organic chemistry 1 and 2 isn't really accepted in other colleges. So if you drop out or transfer, you're going to lose out a lot of time and money. So you really have to be sure that that's what you want to pursue. Number 3 is you're taking 22 credit hours a semester. You're doing summer semesters. They're trying to keep the pace. So if you are someone who wants to do extracurricular activity like a sport or play an instrument or do something outside of academics, it's going to be challenging. Not impossible, but challenging. But I think if you want to do medicine, if you've kind of explored every field in high school, if you've been exposed to everything and this is what you want to do, I think this is a really good option. Yeah,
that's pretty impressive. I didn't know anything about that when I was going through the years. So you have to know kind of early on in high school that you want to become a doctor and then take this path.
Right.
Do you know how many schools are out there that have this kind of joint undergrad MD degree?
So I know that there are at least 2 that are 6-year programs. So I know there's one in Ohio and one in Kansas City. And the basis of them, from what I understand, is it's meant to create more primary care physicians in that state because it's an area that doesn't have a lot of providers. And so they're trying to motivate local people to go to the school. So local students have a lower tuition. So if you're a local, like in-state tuition, your tuition's going to be lower. But for regional and out-of-staters, it's going to be much more expensive. So I know there is one in Ohio and one in Kansas. I've heard of one on the East Coast, but I think that might be a 7-year program. So there's many 7 and 8 year programs. There's not that many 6-year programs. I know of 2 off the bat, but I think a quick Google search will give you that answer.
Gotcha. Okay. And then thinking back to med school, did you know, like going into med school, that you wanted to go into orthopedics, or like did you do a rotation? Like what got you interested in orthopedics?
Right. I had no idea I wanted to work orthopedics. I just wanted to do medicine because I had explored teaching and dentistry and pharmacy, and I job shadowed a lot. And I just knew, okay, medicine's it for me. That's what I want to do. So that was, I had otherwise really an open mind when I went into medicine, med school, excuse me. And then just doing my rotations, I realized, oh, I really like rheumatology. Oh, I really like radiology. Oh, I really like surgery.
Yep.
And then I kind of got exposure to orthopedics just on my surgery rotation, just my general surgery rotation, because we didn't have cases that day and ortho did. And I was like, oh, this is like a really nice mix of everything that I like and more. And so I decided my surgery rotation was my last rotation of my 3rd year. And I decided I wanted to do orthopedics during like the first month of that rotation. So pretty late, honestly. And then I just kind of, pursued it, and it worked out, thankfully.
Yeah, absolutely. I get a lot of questions from students that are concerned. Like I got a message the other day from a young lady who's like, hey, I'm a young lady, I'm really small, but I want to do orthopedics. You're, a testament that, you don't have to be 6'6", 230 pounds to be an orthopedic surgeon. No, anybody can do it. You just have to, work really hard in med school and, do the right things to, match into orthopedics. Is very competitive, but, it's not impossible to get into. What are your thoughts on for women out there, or, even men who may doubt themselves because of their body image or the way they look, to get into orthopedics?
Yeah, I absolutely agree with that sentiment that, I think for some reason there's intimidation around just surgery and orthopedics, and, maybe we as orthopedic surgeons aren't working hard enough to combat that, but I don't think so. So I have peers that are men that are my height and my size, and they never, that never hindered their progress in the field. I think, you have to be mindful, okay, so I'm, I don't have the largest biceps. I need to be mindful. If I need to put a mold on a splint, I have to use, mechanics and physics and problem solve, and maybe use a stationary object to put my mold against, or my knee instead of my hand. Or, you have to absolutely problem solve and kind of think on your feet, but it's not like you can't do it. It's not something that's going to prevent you. And really the gist of it is that in your 5 years of residency, you're going to have to, reduce joints and do kind of manual labor and all that. But if you want to do hand surgery or foot and ankle or sports or something that's not, requiring a lot of physical activity, just those 5 years are really where you might be hindered by, or might have to problem solve around your size. The rest of your career, like hand surgeons, they sit and operate. You don't have to do a lot of physical activity. Foot and ankle surgeons, we sit and operate in hand. So, you can create that decision when you get to it, but you don't let that be the guiding that, oh, I'm 5'4". I need a step stool in the OR most of the times when we're standing, because my attendings are usually taller than me, but that's okay. That's fine. That's my little, crutch, and that's fine. So you just have to work around it, but it's not a stop point or a reason not to pursue the field, in my opinion.
Gotcha, and I definitely agree with that. Do you get confused at the hospital a lot from people confusing you with not being a surgeon? What are your experiences with that?
Yeah, I mean, I think that's, it's okay, because there is a stereotype there that, and the stereotype is based in reality. A lot of women are nurses, and a lot of men are surgeons. I mean, orthopedic surgery is mostly male dominated. Nurses are mostly female. So yeah, I get confused with being a nurse all the time. I get, oh, you're too young to be a surgeon, or are you really my doctor, that type of thing. But I try not to take it personally. I think it's based in reality. So yeah, we're fighting it. Change is slow. You just have to be confident and secure in your abilities, and convince the patient that no, I'm old enough to know what I'm talking about. I have the experience. Yeah, I'm a woman, but I know what I'm doing.
Yep.
I think if you react in a very personal way, or you take it personally, that's probably not the right way to do it. Change is slow, and you just kind of have to be the example, and that's how people learn. If you react in a negative way, or you can say like, oh, how dare you say that, I just feel like that's maybe not the best way to do it. It hurts sometimes, but I think I just learned that people aren't trying to make me feel bad. They're just truly, they don't understand, or they don't know, and you just have to explain it, and they'll do better.
Yep. Just be nice to him. I got confused the other day for a nurse, and I just be nice to him and tell him that you're the surgeon. But and then for residency, going through and then choosing your fellowships, why did you choose foot and ankle surgery?
Yeah. So I was between hand and foot and ankle surgery. I liked those two fields because of the variety of cases. You get to work with fractures and soft tissue and elective procedure versus trauma, and there's just a lot. There's no two cases are the same in the day usually, which I liked about it. The way that I did it is I ruled things out rather than, so I was like, I don't want to do joints because I feel like it's the same kind of surgery every day, which I loved initially, but I was like, I don't know if I want to do this the rest of my life. Spine, I didn't like necessarily just because of the exposure I got. There were really long cases, and I was really like, I don't know if I want to be standing for, That's not always true. You can do smaller, like ACDFs and, decompression, as you know, but I just ruled it out. Sports, I just didn't like. I'm not a fan of arthroscopy that much. So I just ruled things out. So I then was able to land on hand, foot, and ankle surgery. And then mainly it was about, okay, do I fit into this field? Do I like my peers in this field? And I just felt like with hand surgery, it's a lot more really meticulous, like the surgeons are really meticulous, my way's the right way, that type of thing. And foot and ankle, I just felt like all the people I met that were my attendings in foot and ankle had a really balanced life. They were happy at work, happy at home. They got along with their peers, and I just felt like I fit in. So really at the end, it was just like, I just relate better to foot and ankle surgery. It wasn't like I liked the anatomy more or the procedures more. I liked them both equally, but that's kind of why I went into it. And then the second reason was I knew that I needed to stay in Houston because of my husband. So the fellowship here, was one that I could do and also stay, and be with my family. So sometimes you do have to think about your future, your long-term career as well as your short-term, like, hey, I want to be with my family. If I'm really equal on both, maybe I need to also think about, like, hey, can I live with my, husband and also take care of my kid and be together? Those two were really the factors why I went into it.
Yeah, and it's a balancing act, and you mentioned the kind of the balanced lifestyle. That's another misconception that, being a surgeon, you can't have a lifestyle. You're going to be busy. You can't have a family. But it seems like you do that pretty well. You're a wife. You have a kid, and you're a surgeon. So what do you have to say for the people out there that want to become surgeons, but they're worried about the lifestyle, that they will have no time to spend time with their family and do things that they like to do?
Yeah. So I'm no expert at it. I've been married for 4 years. We met in residency, and I think part of it is just you get lucky with the spouse. Like my spouse is understanding. He's in the medical field. He's an interventional cardiology resident or fellow, so he knows, why I'm busy, why I'm not home, that type of thing. So, but part of it is you have to have an understanding spouse, and you really need to talk about that before you marry your spouse. That hey, like my career is important to me. I want to have a family, but you kind of have to understand each other. That's important, and I give that to him. Number two, I think, again, I'm no expert, but I think there's a lot of sacrifice. Like I said, I really wanted to try to stay in Houston. I could have tried to, go away fellowship for a year, and yeah, that's fine. If that's my priority, absolutely. But if my priority is I want a balanced life, I want to be there for my kid, I want to be there for my husband, then if I'm still going to be able to pursue a career in orthopedics and still get a job that I want, then maybe I need to think more about like, okay, yeah, it's fine if I stay here and, still get the training I can get and still be a good surgeon. So you just have to think it's a balancing act. It's not all about one thing, my career, my surgery, that it's about a whole, like, okay, what's the whole picture? What's the long-term picture look like? If I leave my husband for a year, what's my kid gonna do? You know, that type of thing. So I'm not saying that your priorities come last or your career comes last. It's a balancing act. You have to, everything kind of needs to get some attention.
Yeah.
And then number 3, I think you have to be, you know, like I had my kid in residency and I was a chief. And so I think you have to kind of be considerate about timing. So you need to time it right. Like, okay, I don't want to have a kid when I'm on call every other day and my peers are going to really hate that I'm not there taking call and they have to cover for me. So I need to be mindful of, okay, I can have my kid when I'm in my last year and my call isn't that bad. I won't even miss any call because we only take call once every 5 weeks. So I'll be back from maternity leave before I even, you know, am missed. You just have to be a little bit more mindful about timing and about how it will affect your peers and just kind of plan it out. But if you do all those things, it's doable. It's definitely not impossible. If I can do it, you can do it. You just have to kind of keep those things in mind.
Okay. And then what type of procedures do you do in foot and ankle surgery for the people that may not know what that is?
Yeah. So foot and ankle ranges from anything from trauma, so like articular injuries around the ankle joint, so pilon fractures is what we call them, but you know, so joint injuries, ankle fractures, treating trauma like calcaneal fractures, any type of bony fractures around the foot or ankle. And then, so trauma, it could be like joint reconstruction, so whether that's like a fusion of the ankle joint or any joint, again, in the foot and ankle, or joint replacements, so ankle replacements, deformity correction, whether that's like a flat foot reconstruction or varus if your foot isn't aligned correctly to fix that problem, to soft tissue, so like if you have a nerve impingement or, you know, that type of thing. Sports related injuries, whether that's like an Achilles injury or tendon tear, tendon rupture. There's a very vast majority, from fracture to soft tissue to sports injuries, nerve injuries, neurovascular injuries, to, you know, that, so there's a vast array of it if I'm thinking about it. To bunions, I mean, you could even just be working on like toes and, you know, that type of thing. So there's a large majority, but, you know, most foot and ankle surgeons take general call as well, like I will do, so you could still be fixing hip fractures, fixing distal radius fractures, fixing possible humerus fractures.
Okay. And then to become a foot and ankle surgeon, you know, the med school, which is for you, was 6 years combined, and then 5 years of surgical residency, and then a 1-year fellowship. And then, after that, how does your lifestyle kind of look after that? You mentioned kind of the pretty balanced, or
hopefully. I mean, that's so I took a job at a private, like it's a physician-owned practice in Houston. It's called Kelsey Siebold Clinic. So I will, so far from what I know, I'll be doing clinic 3 days a week and operating 2 days a week. When a lot of times when, I'm sure you can relate, when you start off your practice, you kind of have, you know, like, hey, this is what 3 days a week of this and 2 days a week of this. And then as things evolve, as you notice, like, hey, I need more OR time, or, oh, actually more clinic time, things kind of evolve. But, and then there's probably like one weekend call a month where I'm just taking home call, where I'm at home and I have a pager or cell phone, and I'm getting calls from patients or the ER telling me like, hey, can you help us with this? What do you do? But overall, it's like an 8 to 5 type of gig during the week. And then maybe once or twice during the month, during the week, I might, you know, just get calls from patients like, hey, I had surgery, I'm in pain, you know, and I just order them medications. But usually I'll have a PA, someone helping me, also taking calls and filtering out kind of the other calls. So pretty balanced life. You know, my dad's an engineer. He worked probably the same hours that I did, that I will be.
Okay. And then I know it varies by location, practice type, but coming out of your training, how much can a foot and ankle orthopedic surgeon kind of expect to make?
Yeah, I think foot and ankle surgery is one of the lower earners when it comes to orthopedic surgery, like pediatrics, foot and ankle surgery. We don't earn as much as, say, spine surgeons or joint surgeons. So that does vary depending on what specialty you go into. It does also matter, like, where you're, exactly like you said, where you're going to take a job, what, you know, what type of practice it is. For me, it's closer to like 500, but there's certainly jobs where I interviewed where it was closer to 300, 400. So it varies. Yeah, that's my answer.
Okay. And then what type of advice will you have for pre-med students out there, or future orthopedic surgeons, future doctors, what type of advice would you give them?
I think it's a long journey, but I always will tell myself and tell others that it is a marathon. Like, you have to persevere. It's not like a short sprint. It's a lot about perseverance. There's a lot of exams. It's not just step one or one, there's a lot of hurdles. So if you think about, one test is, oh, this is the be all end all, it's going to be really hard. You just have to remember it's a marathon. You'll get through it. Just keep swimming. Just keep going. That's something that I always kept in my mind. The days are long, but the months are short. And I think that kind of helped me get through it. That, okay, I mean, I'm really tired. It's been 24 hours of call. I haven't gotten any sleep, but it's okay because tomorrow's a new day, and then the next week is a new week. So that's it's a long process, but there is now, I can tell you I'm in my last week, as you know, there is an end to, that process, and it does come eventually.
All right. Awesome. I definitely agree with that. All right. Three last questions. I ask this of all my guests. What is your favorite thing to do outside of medicine?
I think traveling. We're really big on travelers, yeah. I recommend everybody go to Turkey and Morocco. Those are my favorite right now.
Awesome. I haven't been there, but Morocco is definitely on my bucket list.
Yeah.
And what is your favorite food?
Oh, that's hard. Man, we eat a lot. Right now, it's Uyghur food. I don't know if you guys have had it, but in Houston, there's a lot of variety of types of food you can have, so Uyghur is my favorite right now.
Okay. Awesome.
Yeah.
And then, do you have a particular surgery in foot and ankle that you enjoy the most?
Yeah, total ankle replacements are my favorite surgery right now. They're fun cases to do, and patients tend to do pretty well if you select the patients correctly. They tend to, be really happy and be able to go back to activities that they weren't able to do before. So that's my favorite.
Sweet. Well, Dr. Aziz, thank you for coming on today to join me and telling us about your journey. If students out there, or if anyone, patients that may see this and want to see you, how can people get a hold of you?
So the best way currently is my Instagram, which hopefully you can put in somewhere. But it's Dr. Aziz MD. Yeah, that's the best way. If you message me, I will get back to you. And hopefully you can find some videos on there that, can supplement what Dr. Webb has already taught you through his channel.
Absolutely. Keep up the good work with that, and congrats on all your success. One more week for both of us in fellowship. Congrats. All right.
Congrats to you too.
Thank you. For everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.